All right, good morning, everybody. Welcome back. This is Dr. Goforth at Cornerstone Physical Therapy. We are at our Woodfin location where I work at near Beaver Lake. So if you're out on this side of town, come see us. And today I'm going to be talking briefly about males with urinary incontinence. So we're going to start off with men have urinary incontinence because a lot of guys don't necessarily think about having that issue. Why? Why would anyone, let's say male or female, have urinary incontinence? Well, for women, you may have heard of it, or if you are a female and you've had children, it's more common after childbirth. It's also common if you've had years of chronic straining with bowel movements, male or female, whether it's urinary leakage or fecal leakage. So why would men have them, and why do women really have it in the first place? So I'm going to grab my pelvic model here. So here's the pelvis. Let me orient it because I'm backwards here. There we go. That's more or less correct. Okay, so the top part here, that's the top of your pelvis. Those bony landmarks you find on your waistline when you kind of dig your hand in, you're going to feel this bony shelf. Here's the pubic bone in the front. And then behind there is where the pelvic floor is at. So this is an external view. This is technically a female model, but the muscles are almost identical. It's just, of course, if you have female anatomy, you have one extra orifice, the vaginal entrance right there. But otherwise, male, female, muscles pretty much the same. We can take a peek inside, and everything inside that's red, hold that up for you a little bit, those are also muscles. So collectively, on the inside, the deeper muscles, on the outside, the more superficial muscles, those are all the pelvic floor. We're just going to keep that general for right now. So male or female, if those muscles are strained, whether it's through childbirth, the chronic straining with constipation that I mentioned, weightlifting, breath holding, and for a male, another reason you might have it is if you've had prostate surgery. It's a very common one, and that's what we're going to really focus on today. But I just wanted to show you guys that so that makes a little more sense. Because those muscles, their job is to prevent any type of leakage. The muscles go around the urethra, they go around the rectum, and they sit up underneath those organs as well, the bladder and the rectum. So their two main jobs are to not let anything exit, urine or fecal matter, when you don't want them to, when it's not the appropriate time. And then number two, hold those organs up and in. So moving on with that, that's why someone could have urinary leakage. So more specifically for males, you've had prostate surgery. So in one of the other videos, I kind of talk about this a little bit more, but just to reiterate, the prostate in males is kind of like the size, shape of like a walnut. And in the middle of it runs part of your urethra, and contained in that part of the urethra is the internal urethral sphincter. Now, depending on your surgeon, depending on how bad the cancer is, for the reason they might remove the prostate in the first place, they're going to either do a prostate sparing surgery, where they're kind of snipping around the urethra, literally trying to spare, not taking out that internal urethral sphincter and not having to be more disruptive than they have to. Or they're going to do what's called a radical prostatectomy, where, maybe the surgeon's a little more concerned and your cancer is a little worse, or they just don't want to take chances, so they take out the whole prostate and that part of the internal urethral sphincter and that part of the urethra contained within the prostate, and then they reattach from below and above. So if you think about that, that's not a minor surgery. You might not be that sore afterwards, but it's common for men to experience urinary leakage and erectile dysfunction sometimes after having prostate surgery, especially if it was a radical prostatectomy. So that's where we come in. Pelvic health specialists specialize in treating any type of incontinence. We work with women and men. If you come to our Woodfin location, we treat both, actually in Arden as well. We treat both male and female, I believe. But if you don't live in the Asheville area and you're going to see a pelvic health specialist, or wherever you go, double check, if you're a male, that they treat men, because it may be that they haven't had that extra training yet and you just want to get the best care possible. So that's kind of in a nutshell. Why might someone experience urinary leakage? A few common reasons. And for males specifically, just kind of talking about that prostate surgery a little bit, and what to expect. You might have urinary leakage, you might have erectile dysfunction. Potentially we can help with both. To take it one little step further, if you have erectile dysfunction, the other thing you definitely want to get checked out by your doctor is blood pressure and your testosterone levels. because although we can address the muscles and scar tissue to a certain extent, we are not going to be able to fix any type of hormone imbalance or blood pressure. So definitely check on that, and please post any comments or questions below, and stay tuned for our next video. Have a great day.